Hi, everybody. Can people hear me at this point, Kerry?
I believe they can.
Okay.
Chat in if you're having any problems.
Okay. And then, Kerry, you're handling the chat, so I won't worry about the chat.
Yes.
Okay.
So Michael, yep, yeah, everybody's set. So you're ready to go, Leo.
All right. Thank you. It's a pleasure to be with you today. Really excited about doing this, and we're going to try to squeeze in both the budget update. The budget update's about 4 slides, and the other presentation that Ellen Taverna, our policy officer, will be doing with me is going to be, it's about 30 slides. We're probably going to do an abridged version. So thank you for being with us today, and thank you for doing what you do as well. So the governor's budget is a pretty remarkable budget for the fiscal year that begins on July 1st, 2019 and ends on June 30th, 2020. It's a significant, the largest piece of the budget increases in the residential services, but also a very nice surprise was $4 million or 61% increase for what's called the DSC DDS program. So we'll talk about that in a minute. I'm going to lay out just the scenario when there's a budget every year. And the scenario is that every year, students graduate from school needing adult services or supports. In 2009, that was 630 students. In 2019, there was 1,073. And of those, in 2019, this year, that we're in, that affects then funding as well for next, 238 needed residential services, 895 day or employment services, and 192 young people were eligible according to the developmental disability standard, which would be autism, Prader-Willi syndrome, and Smith-Magenis. I can't believe I'm spacing out, sorry. Now let me get back. I got carried away here. The other problem is, though, the system serves about 12,000 people residentially, which means each year the challenge isn't just to serve the people turning 22, but how do you keep up with serving folks that are already getting services, and they might have evolving needs. Maybe they age, they have new medical conditions. Maybe there's other increased costs such as wages, healthcare benefits, rents, property upkeep, vehicles. So it's a constant process, and that's true in employment and day services. That's true in family support services across the board. So as we go on to the next slide, which, there we go. These are the budget line items that are usually affected. I'm just sharing these with you. For those of you that are new to that, you can go online and you can actually see it on our site under advocacy, look up state budget, and we post the chart you're about to see. And basically, I like to group them about 3 or 4 ways. There's the in-home or family accounts, which is family support, DSC, DDS, and autism kids. There's the residential account, where a lot of the money is spent through private community providers, and there's state-operated homes, and there's, of course, there's institutions still in Massachusetts as well that serve a couple hundred people. And then there's the grouping I put together of turning 22, employment day, transportation, and aging, where you might be living with staff or you might be living with family or yourself. And then finally, there's the oversight or case management piece, which really is represented by one line item, and that's DDS administration and service coordination. So those are the, how I group it in my head. Are you with family or living independently? Are you in a staffed situation? Are you maybe in one of each, but getting employment day and transportation and other supports, and then oversight or case management? So here it is. Here's the budget, which I'm assuming everybody can see that chart pretty well. I have my thing here that's sort of in the way, the Zoom thing, but I'm hoping that's not in your way. If you look up top, what I want to focus on, really, there was 1.5 million here for family support. This is the first time in a number of years that the administration actually annualized money from this year, the people that turned 22 that got family support, to make sure it was reflected in next year's budget. So that's the first time in family support that's happened in probably a decade, ballpark. The DSC, DDS, That was as high as 8 million we were spending in 2008. Here we are, 2019. We hit the recession. It went down to 3 million, got back up to 6.5. The Baker administration has recognized, wow, let's intervene early. So this is a huge public policy move. It's $4 million additional dollars. As I said before, 61%. It'll provide services helping independent living skills, helping people stay at home, really helping young people stay at home with their families instead of being outside the family home. And it makes sense in the long run. And then Community Day and Work received 22 million new dollars. Despite that, that's actually a tough line item. This shows you how much money, our services require. 22 million, probably most of that, 20 million, is just to make sure those young people, adults now, have the day and work supports they need who graduate this year. Okay, so people graduating this month and last month and next month, they need adult services. It easily will cost annualized somewhere around 20 million next year in next year's budget, just to give you a sense. So what we're worried about is there's a lot of services with the closure of shelter workshops where agencies obviously lost some revenue there from selling things that help subsidize services, as well as what's called community-based day supports that require more staffing to get into the community in small groups, 2s and 3s. That's still, we're struggling to reach that goal. And then turning 22, if we go just back a couple of steps, that is the third year in a row that we've had the new formula that really addresses the 1,000 people graduating. And then getting back down there, community residential, I already explained, is the big winner, so to speak, in the budget because of the fact that people are being staffed in many cases 24/7, 24 hours a day, 7 days a week, $86 million in maintenance funding and turning 22 funding. So it's probably, I assume, and we've talked a little about this with the commissioner, it's addressing some of the things I mentioned earlier, the fact that people are aging. There's a lot of supports and services. As I know, many providers have talked to me in their homes that they have vacancies across the state. And with those vacancies, some of them may be on purpose to save money. And now with this funding, there may be the ability to serve new people. But what we're hoping will happen is that there'll be some innovation and that we'll start doing more supported living, shared living, the kinds of things building upon people's lives in the community. So here's an opportunity to do that in 2020 if this money remains in the budget and the legislature gives it its okay. And then you have the transportation budget, which again reflects the turning 22 growth. And that's about a $4 million increase, 4 million and change, 4.4. And autism omnibus, big 6.7, something like that, $1 million. But that's all about the people who turned 22 this year again, 192 people. And that's an average of $35,000 person. My hunch is there's a handful of people that have developmental disabilities who needed, whether it's Prader-Willi or Smith-Magenis syndrome or autism as a diagnosis, that need more intensive services. And that probably moved the average up because as a rule, DDS budget's about $25,000 a person in that program. So that gives you a sense of the community services budget on the state accounts. Just to let you guys know, there's obviously big jumps there. Those are all in relation to collective bargaining agreements. So there's no new FTEs. Just to keep up with collective bargaining agreements, you have 20 million for state operated homes, about 5 million, 6 million for service coordination administration. And in state schools, you have a growth of a couple of million. This is really a significant budget. I can't say enough how significant it is. This is the first step of the budget process. So next week we'll have a Facebook Live to really encourage people to contact their representatives and senators about the budget. We're talking with the Trade Association, ADDP, about a strategy in relation to some of the limitations in the budget, in day and work, for example. We'll see where we land on that because we also have a workforce proposal that we're just about to start to share with you as well. We'll take some questions about this at the end, but again, a very positive budget. I went through it quickly so we could do the workforce, but by Monday or Tuesday, we'll have a strategy with other organizations that we hope to share with you about what to ask your representative and senator for, in addition to obviously maintaining this great budget. Okay, let me shift now to the share with you the I want to share with you the workforce piece slideshow. Be right. It's going to come up. Let me hit share again down here. Let's share.
All right.
And this is Ellen Taverna is going to start this. She's the policy officer. Her name. Sorry, I used an old version, so her name's not there.
That's all right. Hello, everyone. Thanks so much for being with us today. I'm excited to talk about our direct support workforce initiative. So today we're facing a direct support workforce crisis, and it's really a product of many factors, but the two big ones are the fact that we've ignored the lack of movement on direct support wages for many years, and there's a shrinking workforce with increasing disability population with growing needs. So we're going to talk today about what the workforce is, the challenges that we're facing right now. But I just want to make sure you guys are, I hope you're all familiar with the ARC. We're an umbrella organization with 17 affiliates, and we work with provider, government, and advocacy agencies. Our mission is to enhance the lives of people with intellectual and developmental disabilities, including autism, and their families. And historically, we've been at the front of increasing resources and opportunities for people with disabilities. We advocate for obtaining public funds to level the playing field for our constituents, passing laws, and implementing educational strategies to address discrimination and promote integration of people with disabilities in the community. And nowhere is devaluing and discrimination as clear as in the fact that our direct support and our direct care workforce simply doesn't track with the salary ranges of education and health sectors. And all too often, the direct support workforce is tracking against the fast food outlets, despite the fact that of all the skills and qualities that our workforce requires. So there's a real crisis that's happening right now, and throughout this presentation, we're using the acronym DSP. I just want to make sure everybody realizes that we're referring to the direct support professionals, and they cover a wide variety of roles, which we'll talk about shortly, and Leo will cover. But there's a real crisis happening in the DSP workforce. According to the Massachusetts Council of Human Services Providers and the Donahue Institute of UMass, it reports that 72% of service providers have found it increasingly more difficult to recruit workers. In addition, there's a 2017 Family and Individual Needs for Disability Support Survey, which was conducted by the University of Minnesota's Institute on Community Integration, along with collaborating with the ARC, reported that the FIND survey reported that 48% of caretakers surveyed are either very or extremely stressed to provide care for an individual with intellectual or developmental disabilities. And many of the caretakers report on problems with the impact their work, the challenges where they're going to work late, or they're cutting back on hours, or giving up on work entirely. So it's a very stressful situation for many caretakers. So we're going to talk a bit more about the state of affairs, look closely at some national and state statistics. So the Americans with Disabilities Act of 1990 and the OMSA Supreme Court decision in 2009 requires states, including Massachusetts, to eliminate unnecessary segregation of persons with disabilities and ensure that people with disabilities receive services in the most integrated setting appropriate to their needs. But we're not able to achieve this integration of people with disabilities without the direct support workforce. So this is a real crisis for families and agencies. Individuals with disabilities and family caretakers are facing real challenges in hiring staff for in-home services, whether it's for care attendance or respite or nursing. 92%, this is the FIND survey again, 92% of caregivers report difficulty with finding direct support professionals. And we're hearing stories all the time from our constituents about real problems filling PCA hours or nursing hours and simply finding the staff to do this. And if you hire someone, they may leave in 6 months. And that's the real problem that we're also facing across the country, is a national turnover rate for DSP workforce, which is estimated at 46%, with a majority leaving within a year of employment. Human resources providers are reporting open positions, sometimes lasting for months at a time. And this type of turnover also spills into frontline manager roles that supervise direct support professionals, because there's a lack of pool to promote from, and there's added stress and hours due to unfilled positions. And these realities are aggravated by several factors. Many providers use legal immigrants from Europe and Asia and Africa, and recent federal changes have stopped or postponed the arrival of many of these workers. We're also seeing an increase in incidence of rates of autism, and people with intellectual and developmental disabilities are living longer, in addition to a growing aging population that needs supports of their own. So we're facing many different challenges. And Massachusetts is ranked 35th in the country on how well its Medicaid program is serving people with intellectual and developmental disabilities. So we've got to come up with better solutions. So looking specifically at Massachusetts, a lot of our statistics looking at the turnover and rate of DSPs is a national problem, but specifically in Massachusetts, it's harder to find workers because of the fact that the Massachusetts unemployment rate continues to remain low at 3.3%. And we're not successfully able to recruit college graduates because they're burdened with high college loans. And so the wages of direct support staff and managers is too low for them, given the burden of loans. In addition, the National Low Income Housing Coalition has reported that to afford a one-bedroom apartment in Massachusetts, a worker needs to make at least $11 an hour and work for 84 hours a week to afford just a one-bedroom apartment. And so our state is ranked third highest in the nation to live in. So we have a squeeze here. So there are low wages on the one hand with a high cost of living on the other. And this squeeze translates into a disconnect in market competition for staff when comparing to other occupations that require less education and training. So the Massachusetts Bureau of Labor Statistics shows that the mean wages of direct support professionals are below those of janitors, clerks, and nannies. You can see the different wage rates of nannies. It's over $17. Janitors are getting almost $17. File clerks as well. Even though, for instance, file clerk requires a high school degree and no other training. And this compares to approximately $13 to $14 an hour mean wage for personal care aides or direct support staff. And direct support staff, direct support professionals require a minimum of a high school degree, and they all require specialized training due to the various needs of individuals with intellectual and developmental disabilities. So in addition to this, we want to make sure that we're valuing our workforce better. So we want to be attracting a committed, long-term direct support professional that is willing and wanting to value their work with people with disabilities and their families. So we need to be looking at universities and high schools to encourage this type of work, to reinforce the importance of direct support professionals. So this was an ad that I found online. It was very striking to see when you're comparing a 12 or 13-hour wage salary of a direct support professional to a Domino's pizza delivery driver, and who was getting $15 an hour. And it's striking to see, given the fact that direct support professionals require so much more training and they require a high school degree. So we show what a big difference that is for many people. So Leo's going to take over right now and just talk about Massachusetts, looking at the workforce a little bit more deeply.
Thank you, Ellen, and that was great. I wish you hadn't shown that pizza ad, though. I'm feeling a little hungry right now. So we're going to talk about our workforce at a glance, and realizing, many of you on the call understand what our workforce does. But, the responsibilities, Ellen referenced the additional training people need. And it's so true, right? Because we're talking about people who are performing activities of daily living. Maybe they're teaching them, which requires even more knowledge, but performing them is pretty, how do you do it right? It's individual, what people would like for help in mobility, dressing, toileting, administering meds. You have to pass a certified course in that if you're in our provider world. If you're working with families at home or PCAs, they also have to know what they're doing. There's also the other kinds of roles they play, shopping or banking. It's so important, to be able to cross that bridge and help people connect and do the instrumental activities that are so important. How about those that are providing employment assistance, interfacing with people at the jobs? And finally, making sure people are truly integrated. Ellen referenced that's ADA and the Olmstead decision. Are people making connections, or are they sitting with parents at home watching the TV, or in a group home or a staff department just hanging there? So this is all really, it's people have to address needs and wants, they have to ensure safety. We need to count on this workforce for skills, responsiveness, problem solving, all while reinforcing respect for those they serve and assist. So it's also critical to understand how deep and broad what we're talking about is. The workforce is hired by individuals with disabilities, caregiver families or neighbors, providers, which are, obviously are the biggest piece of that DDS residential budget I shared before, and then public sector. And then the line items we just talked about earlier, so I don't have to talk about them again. But it just shows, and I'm sure there's others in human services that also need this kind of acknowledgement and respect in terms of the workforce, different agencies. Okay, so now one of the pieces with the workforce is, in addition to having skilled DSPs, you really need to have the capacity to back up these DSPs. Often we are just not resourced enough in the area of clinical resources and clinical teams. Some large agencies may have some great, and when I say large, they're tens of millions of dollars big, but even an agency that might be relatively large does not have enough clinicians, doesn't have enough resources. And on top of that, think of the family or individual living semi-independently, and there's a crisis that becomes an emergency room visit instead of being handled at the home. So we need to address this area with having psychologists, medical professionals, and others, and people as assistive technology experts to address the backup that the DSPs need and individuals and families on their own need. In terms of the professional challenges as well, one of the big areas is folks that are hiring nurses, whether it's in-home nurses or at programs. The rates, there's too big of a delta between what hospitals pay right now, $36 an hour minimum. Clinics or outpatient areas, they're paying $36 an hour. Well, that's not tracking with our field, and we need those folks to get paid. And I already mentioned about there's just an inadequate regional capacity for consultation and professional and problem solving. By having resources, we'll make sure that the staff and family know how to act responsibility for people with acute medical or behavioral needs as well. Plus, we want people living as independently as possible. not being overconsumed by safety and risk because we don't have these clinical resources. And so we end up spending more money in staffing, but not really responding to the actual need or growth desires. So in looking at this issue in terms of the bottom line, it really is about staff. Over 70% of caregivers are family members. When families don't have support, jobs suffer or are lost. Staffed homes with vacancies, and they're approaching 30%, I'm hearing from a lot of people, means more safety risk, disruption, and clearly isolation. So a nuanced response to this crisis and bridging with the health and education, benchmarking with the health and education sectors is essential. So we're going to talk about our 4 strategies, and we want to make it really clear on these strategies. We want to address the value proposition here about quality staff, quality system of support. And we believe that this long-term problem needs a long-term strategy for today and for tomorrow. And we'd like the Executive Office of Health and Human Services to hold a planning process of several months, 8 or 9 months, and to chair that. And all stakeholders, that are relevant should be invited to that party and to have a plan that comes out of that. And we have, obviously, our strategies for that, but obviously there's other strategies people will have. So we hope everything's looked at. So basically, and then out of that would be the cost of ensuring the quality workforce would be determined for the long term. So we want to gear compensation to the health and education sectors. We've said that a few times. So that's number 1, the workforce investment. We believe significant in financial investment. We're not, talking about staying at a couple of dollars above minimum wage. That's not going to make it, okay? So that's really important. We're talking about a minimum of addressing the significant gaps in homes and providers. And turnover costs, for example, have been estimated. This is like a conservative estimate in our state of 19 million when you're really dealing with $3,800 per employee and 5,000 DSPs leaving. So that's like a very conservative estimate. So that costs money, so it's not only about costing money with this workforce investment, it's about saving money. In the meantime, we want to jumpstart addressing the crisis by this fiscal year in 2020, seeing the entry wage become $17 an hour. Clearly, this is important. This would become a prevailing wage for all entry-level employees. And then secondly, you would address compression costs. And we have a bill that's filed by Representative Garlick, and Senator Feingold has signed on to the House bill. And we're asking senators, because we're still going to be revising. House rules allow us to keep working on the bill for the next couple of weeks, believe it or not. So we want all staff earning $75,000 and less a year to also get an allocation. What compression cost refers to is when you do have new staff making $17 an hour. You want to have senior staff, program directors, managers, people that have been around and tenure to also get relatively a ratio of increases as well. So we don't suddenly have an issue where morale is affected and people who have been working for less are not also benefiting from this investment, and they are able to be retained as well. And we believe contracted staff should also benefit from this, including PCAs and folks in the rehabilitation program. And we figure out some kind of ratio for people who are shared living and adult family care providers. Long term, we recommend, again, hey, this is the 4th time, we'll say it again, to benchmark the health and education sectors. And we're giving you a sense here. Basically, direct support professional by 2025 should be at $24 an hour for entry, frontline manager at 36, and a registered nurse at 36. In fact, the nurse one, I might be a little chintzy for the earth might have been chintzy on that one. Maybe it'll be higher because right now it's 36 at clinics and hospitals. So depending on the inflation and cost of living increases they get by 2025, that might be a low number. So now employee benefits is part of this. We believe tuition and loan forgiveness like the loan repayment bill submitted by the council is the way to go. We'd love to see 100% loan forgiveness by the end of 10 years. Okay, so if someone stays with you, or whether they're helping your family, helping a person living semi-independently, or at a community residence or a day employment program, they would, after 10 years, have complete loan forgiveness. Expand the tuition credits program that exists now. I think we'd want to look at the fees issue at the state schools as well, where that's such a big part of the cost. And then there's all kinds of other strategies, and I'm not going to read them all, but one example is tax credits to allow retirees that are capable to receive an increased benefit from employment. There's a lot of young retirees out there who could really make a difference in our world. Strategy 2 is about innovation and system design. Well, you heard Ellen say it's not just about being more market competitive, and remember, it's totally appropriate to be market competitive, right? But it's also about we're not going to have as many people around. So we really have to have a commitment to individuals and families first, offer packages, building on one's community. Don't uproot someone from Weymouth and give them the service in Marlborough. It really is not logical, but sometimes we're forced to do that because whether it's state staff or provider staff or case managers, they're thinking only about 24/7, 24 hours, 7 days a week. Sometimes the school systems, they're not really telling families about all the possibilities, or the students. And we also believe the HCBS waiver should be modified so that guardians could also provide AFC. That can't happen through the state plan program, but it could happen through the home and community-based waiver. We would have safeguards, obviously, for that. So it would be the right situations for the people if it's a non-family. Even with families, sometimes, people don't want to stay in the family home. It's not the situation. But as a rule, this would clearly make a difference. Provide care management. That's huge. Right now, there's families who are trying to do it, and individuals self-directing who just can't get the support they need through care management. They don't need someone just to ask them what they've done to recruit someone. They need someone to help them recruit people, okay? As well as maybe train them, get them up to speed. Enhance the resources for support and shared living programs. Make incentives, and then finally develop additional life or job coaching to promote independence. These things are being done today, but they're not incentivized. And it's common sense. And just basically part of the strategy is completing the transition from institutions to home and community. How's that for code language? Implement technology for individuals' advancement and service system improvements. Communication, safety, travel, they can all be enhanced with the right tools. Review regulations for replication, for barriers, and of course make sure they're sufficiently there as well. And then something that's sort of off the table for this, but we had to keep it in here. It's something that requires a task force that includes LEAs, local educational agencies, and the Department of Early, Elementary, and Secondary Education, is really looking at how well they're preparing students for adult life. We think that's a huge issue. So then we have the issue we've sort of referenced earlier, was the lack of clinical and other consultation. Let me touch on that, just the 3 major areas that require it. We sort of referenced the fact that families and service providers need to have more access to regional consultant teams. We used to call them clinical teams, resource teams. We had really rich resource teams when the community system was first being built. We're missing out on that, today. I know there's some great clinicians and consultants at the university centers like UMass and ICI and Shriver and elsewhere, but we just don't have enough of that, and we have to build capacity. Also, secondly, I'm going to talk about practitioners out there. We're still not getting adequate healthcare, access to adequate healthcare, and we need medical, behavioral, dental, and other practitioners to get the training they need. We do Operation House Call in graduate schools and medical schools, but we also need to have these teams to get dentists involved, enrolled, and other medical people making the right decisions, so everyone's not going to the same practitioner, the same primary care specialist, the same neurologist, so we need to build that out more effectively, including building more behavioral health capacity. And finally, specialist utilization. We need to have telehealth and video health sort of access for providers and families and individuals, so that, let's check in with you. We're nervous. So-and-so just fell. Should we really have to go to the emergency room? Maybe they have to come in person. Maybe there's another emergency. People can be coached. So those should be like standard within 2 years. And on to the last strategy. It's all about human capital. This is what we've talked about: the value proposition, the quality of the people. In one of our attachments, we really argued, and by the way, you can see all this at thearchofmass.org/workforce. The only thing you can't see is the bill. But bottom line, we argued that probably there's a minimum of 700 extra staff out there. Yes, people documented why they're needed for people, but it's all about not having the right staff, the right place, at the right time, not having the right consultation, so on and so forth. So human capital development is key. And so first place, let's review the existing allocations for recruitment, onboarding, and staff training. Let's make them transparent. Are they sufficient? Obviously, you can make those as good as you want, but if you don't address the pay and the benefits, you're still going to have this, circle of very frustrating applications and responses to those, ads. Pilot a regional or employment collaborative for workforce recruitment for individuals, families, providers. Families and individuals who self-direct are really struggling to finding personnel, and some, I bet, providers that don't have huge human resource teams would love to have some kind of collaboration on this. Facilitate high school and college prep for our field. Again, a lot of this used to be there 20 years ago, 30 years ago. They stopped having these programs because of the pay in the field. And even though here our field's growing, it's sort of antithesis to what should have happened. But we need to see the Commonwealth encourage, have this as part of the plan where high schools and colleges, do this. And if it wasn't for some of the internship stuff that goes on, I don't know where we'd find people from those settings. And then ensure once those allocations are made for onboarding and recruitment and all that and training, ensure accountability for that. And then finally develop career paths and consider alternative certification. And again, that's nuanced. That's going to be different in different ways. Different agencies, different sizes. So it's really important. Those are our 4 broad-based strategies, and you can see why we'd want to see a task force. And then, during that point, after that period, to have people get sharpen their pencils and come to some decisions, and then figure out the costing. In conclusion, we have been a leader so many times in supporting people with intellectual developmental disabilities in public education, community integration. Right now, our stat on community integration is number 35. Who would have known? But once again, we can become a trailblazer, and that means resolving the workforce crisis to do it. And one of the things, this isn't for legislators, but it's for us. David Braddock, who edits the State of the State on intellectual developmental, I guess it's developmental disabilities. It's our source book in our field. He said in the early 2000s, he put it out there that a lot of the most important achievements have been between interest group activity and the goals. And he said the link between interest group activity and spending can be powerful. And he's right. So what we're looking to do is build a broad-based workforce campaign. We're looking forward to work with partners, whether they're trades who have been involved, in the issue of Chapter 257 and brought that forward, or whether it's other advocacy groups, and we're looking forward to that. And basically also with families, our goal is to recruit family leaders and board members from across the state geographically. We have a team ready to connect them. We're also looking for other people to do the training and share this PowerPoint with them. And we're constantly evolving it. I can tell you this educational piece has evolved 6 times since we did the first draft test of it. So it's been wild. So, okay, without any further ado, I think I want to take the time now to basically open it up. And I think Kerry uses the chat process versus having people ask the questions by phone, right, Kerry? And
Yes,
Ellen,
thanks.
Ellen
Yes, thank you, Leo and Ellen, for the presentation today. So Derek has a question. Will there be a component that will educate caregivers on how dire this situation is so they can advocate for these changes?
Well, that's a great question. It's funny. I'm hoping we're doing some of that with our broad-based Facebook and when you say caregivers, is Derek talking about also staff? Because there is the caregiving force that the council hosts, which has been around for a while. But in terms of families, we're hoping presentation, working with agencies and maybe consumer advisory boards and other groups that we get the word out. We're also, again, looking for family leaders to be part of that in terms of their geographic areas. And we're recruiting stories. So you can share stories. In fact, I think, is there a link on the workforce page, Kerry and Ellen, to just hit that to share your story? I know we advertise it all over the place.
Yeah, there's one on supporting families. We'll have to make sure that's on there. But yes, Derek was really wondering about parents and guardians.
Yeah, so that's what so Derek, yes, so that's a huge piece of this. We think people with disabilities, parents and guardians, siblings, they're going to make the difference on this, that they need to be there on this. And if we don't take this seriously, and the other thing related to that question is, and I'm sure other providers we're close to may ask about this too. Some of our affiliates just the other day said that they've been starting to talk to their families about how serious it is. They feel like they've kept it from them because it's their job to run a good agency. And Ellen worked on a draft of a letter that they can share with families that says what the status of the situation is, and they need their engagement. So that's going to happen. And some of our sponsor members and others may want to do that as well. I can tell you, we were at a CAB and a provider agency last week, and people get it, and they're going to get the word out to their families. I know that, especially at that agency.
Right. So up on the arcofmass.org/workforce webpage, we have our full proposal that, we summarized it in the PowerPoint, but it goes through in detail about what we're proposing. And it also provides fact sheets. And then in addition to this PowerPoint that we've shared today, which we may update. But we'll have more information. As Leo mentioned, there's the bill that we're going to be pushing out there. So we'll have
House doc at 11:30. FYI, you can get co-sponsors for that bill from House or Senate can sign onto the House docket. And they should know how to do that. But Representative Garlick, Senator Feingold.
So we're putting together, we have, individual fact sheets for all of our issues, including the workforce and the workforce bill. But we'll also have an action alert that you can contact your senators and your reps to encourage them to sign on to the bill.
Other questions, Carrie? Because
Okay, yeah. So actually, some questions and comments. Lucy said, "Congratulations! I've been waiting for years for a campaign such as this. Job well done." And then Diane had a question on the budget. Any information to share about the adults with autism still waiting for funding?
Yes,
and then regarding, okay, we'll take that one first.
Let's take that one. So there's, so again, very thankful to the governor and Secretary Sutters. And I love working with Secretary Sutters. She's transparent, she's blunt, and I love that about her. And I think she really cares and knows the system. But, life's, this is autism adult or autism omnibus, whatever you want to call it. That's 6.8 million or so. That's just for people who turned 22. So anyone who didn't get on the train in 2015, missed it because they graduated early, or someone who was turned 22 before FY15, I think it was FY15, they're still out of luck. There still is a waiting list, and we're hoping to work on that. It's really, I just want to be really honest with you. If you care about that issue, you really have to reach out on that issue because there's several line items, okay? And after the 2 or 3, the rep or senator's eyes or the aide's eyes are going to glaze over. And so sometimes people have to take on specific issues. The other line item like that is day in work. that we're concerned about. So good question, great point. And again, because of where we're at, and we want to really push the workforce as the #1 priority, you know, obviously along with passing the registry bill this year, we just feel like, you know, we're not sure what we're going to do yet. Monday we'll know what our strategy is. And ADDP, which is a trade organization in our field, and we were talking it over together to try to figure things out. And what was the second part of the question?
Okay, regarding the direct support providers, strategy #2, transition people in institution to home and community, great. My concern is the increase in state facility line item in the budget.
So that's collective bargaining, you know, for both that and not for both that, for 3 items. And that's it. And well, I'm not going to provoke anything further than that, because there are other expenses as well, not in the DDS line items. But the bottom line is they're simply, you know, there's a union, there's collective bargaining agreement, and that's the deal. And as you might know, if you've been watching this, it's gone down in the past. So, and that's why we need the transition. And again, sometimes people that favor those settings say, oh, you know, you're not getting enough funding in the community. We got to keep those settings. No, that's part of the problem. The community is the place. That's what the law is. But more important than the law, we know from studies for 25, 30, 40 years that's the best for people with disabilities. So anyway, let me stop there.
Okay. And then Jennifer had a question. What can parents do to help? My child currently works 2 small jobs, and he's a very good worker.
Well, you know, as we mentioned before, I think the key to our advocacy is going to be in sharing the stories of family members and their experiences, good and bad, with the workforce. One thing that we're actually doing right now is we're hosting a contest where families can submit a short video, 1 to 3 minutes, about the value of the direct support workforce, and you can send it to the ARC. You can, there's more information on our Facebook page and social media, and I know that we've blasted out on our email list as well. But it's open until February 14th, and if we choose your video, we're gonna send you a $50 gift card as a prize. So we really want to promote the stories of the value in the direct support workforce, and show you know, that there's such a huge need to retain qualified and responsible workers.
You know, one thing I want to add to that is I think this is being taped, Kerry, as the other sessions are taped, correct?
Yes.
So you can tell the families and organizations about it, so they can go online, and we will post the link to the tape. It's free, and people can go ahead and watch the video as well and learn about it. So we get more people involved, and before February 14th, hopefully, so we'll get more stories too that we can pick from.
Yeah, but we'll be sending out more information as far as, you know, what you can do with action alerts, just to send, as I mentioned, to our legislatures. But you know, we want to make sure that you're well informed about the issue. So we welcome you to visit the website, the webpage again, and find out more information and download the fact sheet. So to educate yourself on the crisis.
And I'm going to repeat one more time about House Docket 1130. That is something your representative or senator can sign on to, and they have to, I think you can keep signing on in the Senate past February 1st, but tomorrow, technically in the House, it'd be great for people to call and say, hey, well, have you signed up? You know, don't assume they haven't, but it's a high priority for us, House Docket 1130, the workforce legislation.
And the thing we want always keep in mind, it's just that this is a national problem. It's not going away. It's only going to be, you know, it's only going to get worse if we don't put out better solutions. So that's something we want to stress to the administration and to the state legislature, that this has to be worked on, and it has to be worked on now.
Okay, great. And then Michael had a comment and some questions, said it was a great report, really comprehensive. Was wondering who has it at this time? Administration, collaborative, and what about the cost of the direct support providers, lift to $17 an hour?
Sure. So great question, Michael, as I would expect from you. So yes, the trades got the full package in early January. So those are Mass Council, ABA, the collaborative, that especially because they are the ones that initially advocate for Chapter 257, which is we're going to use rate setting for obviously Medicaid state plan, and 257 would have to be used for purchase of service programs. Sorry for getting into the woods on explaining that, but they've had it. They've had a PowerPoint, that first version, since late September, and request for dialogue. And we reached out to Mass Nonprofit Network a week ago and made sure they got everything. Secretary Sutters had a heads up, but it got the full packet probably before January 2nd, but it might have been right around there, which got everything. And then we will be sending it to key legislative leaders, I would say early February, like within the next 2 weeks. And then it's posted, like I said, on the web. And we do, we showed our interest in, and then the money, the $17 an hour. Okay. So obviously the legislation is a banner for this. We need a jump start this year, which might require outside language rather than legislation. And the money would have to come through, this rate setting process. And you would have to also, the language that's there, that's being worked on by House Counsel, would reference statutes that exist and make sure that other benefits, other issues such as, the background check and costs that providers have, that they have to be transparently defined, so that, we're not putting people in a corner. People are in a corner now, let's be honest. People, whether they're families that aren't getting enough money for people, or it's providers who are given a rate increase, but it doesn't really cover all the, costs. What we're adding clearly another stressor to that by saying there has to be prevailing wage. But the flip side is, if everyone sticks together, we're also asking for transparent accounting of real costs and market costs.
Okay, a few more questions. From a question from Susan: can an out-of-state guardian make a difference?
Yeah, if you use your kid's address, if you use your protege's address, ward's address, you're going to need, the best thing an out-of-state person can do is think about who they know in the state and get them to be their surrogates. And then if it turns out, who knows, you might have grown up or knew someone who's now a senator or a rep. I mean, there's always a way you can make a difference. But clearly, just calling your rep or senator you don't know and say you live in Hawaii or Vermont, that's probably not going to cut it. But yeah, those are the ways you can make a difference. Hey, you can also send us a donation. We're good. This is all fueled by either donations from organizations, families, corporations. That's how we do this work.
Okay, thanks, Leo. Lucy had a question. Is DDS in agreement? At a recent meeting with the commissioner in attendance, I didn't get a feeling that they were on board.
Well, I think what we're asking is significant in a year where DDS got probably the most increase in a governor's budget in, I don't know, a decade, not counting Chapter 257 in residential increase. So if you took that off the table, it might be the biggest in 20 years, okay? So there's that dynamic, right? Anytime things cost more money, the governor's set forth a generous platform for us. And again, they work in their context. We have to work as advocates in ours. And you saw that quote from David Braddock that Ellen put back up. I don't know if it's up there or not still. It's right there on the page. It's really up to us. We can't blink, and we have to be respectful and clear and appreciate what is being done. But I don't expect a commissioner or a secretary of health and human, no matter how high up you are. I don't even expect the governor to say, hey, I'm totally on board yet. Because again, at the end of the day, there's got to be consensus by the legislature, Senate, the House, and the governor on this. We also have to convince the public.
Right.
We have work to do with the public that, geez, you have to appreciate how essential this is, that our society's changed, the mobile society, we need this workforce, but also to show them we're also trying to help people do things based on their abilities, and based on the community and family. So it's not like a free ride here, but it is, we have to level the playing field and we have to have equity. So we have some some work to do ahead of us to keep pushing that. So that's why Ellen mentioned the stories. We need to get press attention on this too.
Okay, thank you. And then I'm going to put Rhonda's and Derek's questions together. Rhonda asks, is there any talk to changing the qualifications staff will need if the rate goes to $17 an hour? And then Derek follows up with the proposed rate of 17, does that include tax and fringe, or is that the employee rate of pay?
So great question. I think Ellen said the average, the last time we checked in this past year, was $13 and something. And that's what a person is the average. Some agencies pay $15 because they've done other things, some $15.50, some are paying minimum wage for certain jobs. So no, that's the pay you get, and out of that comes taxes and stuff. So that's why it's a long-term strategy. You know, in minimum wage in 2023 will be $15 an hour, right? Keep that in mind. So that's the pay, and out of that taxes are taken. So do the arithmetic. But then the average, if we succeed in this, or even if we get to 16, and make sure that the funding is actually there, and there's no, other things that are hiding other costs, and it's a prevailing wage, I think it'll be, the average will be above $16 because there'll be staff with more seniority and tenure that will be getting more than 16. So we will have, so basically our goal is by 2025 to get to $24 an hour. And yes, there would be first place in the front end, no. I mean, right now to get to 17, I think that's fair for what people are required to do, and medication administration and the other training they need and stuff. Now, as we get closer to 20 and 21, I think the idea of certain certification for certain roles makes a hell of a lot of sense, and that's part of the long-term plan.
Okay. All righty, great. And then one more question, and I think this was our last one. When will participants be considered to be on the advisory group that Leo referenced earlier to start working with EOHHS to address the workforce issue in crisis?
Well, that's up to all of us advocating, because we get this accepted and it's on board, then that would be the secretary, her team, someone on a designee, maybe an assistant secretary would lead that, and then they'd ask for names. But we haven't gotten there. We got to convince them to do it. So hopefully it's in 3 months, but maybe it might not be till July. It's up to us, if we have to wait for a bill to get passed or outside language.
All right. Well, thank you. Yes, and we will be sending the PowerPoints to folks. That was a couple of questions, but that's all the time we have today. I want to thank you so much for attending. At the end of the presentation today, you're going to be rerouted to a brief questionnaire to see how you enjoyed the webinar experience, and we hope you join us again. So again, thanks so much. Take care. Have a great day.
Thank you.